Hello, everyone, and welcome to another episode of our Global Ambassador interview series. Today, I am joined by Dr. Harald Nusser, and welcome. I will start with a little introduction, if you don't mind. If you can introduce yourself and your role, that would be great, and then we can just dive into the interview.
Yeah, thank you. My name is Harald Nusser. I have been working with the pharmaceutical industry for more than 25 years in different companies and different roles, most recently in the last 10, 12 years in global health related roles, social business type of roles, and access to medicines. And right now I'm looking for the next opportunity. This may not be in private sector, so I'm curious what the future yields. And right now I'm a Pathfinder International board member. Pathfinder is an international non-governmental organization for sexual and reproductive health and rights.
That sounds very interesting, and we look forward to hear where do you end up. So thank you for joining us again. As I said, this is an interview series that we're doing with our global ambassador to get to know you and to hear your opinion on the most pressing global health challenges. So if we can start, my first question is exactly that. In your opinion, what do you think are some of the major global health challenges today?
Yeah, so let me start with two overarching topics, and I will illustrate with more familiar topics later on. I think the global versus local topic is an important one. So which topics need to be dealt with from a global perspective, from a Geneva basis, for example, and which really need to be looked at from a more community and local perspective. That's one point. And the other point is the youth is rather left out from my perspective from the discussion and policy making. If you recall that 42% of the people on the planet living right now are below 25. And if you then put next to that 75% of all mental health conditions start before the age of 25, then we understand that the social determinants of health and the locality and also the importance of cities play an important role when it comes to prevention and to understanding diseases better.
Thank you. And that's a very good point. And that was not raised before. So then and that's a very interesting take on the involving youth. So moving on to the next question is kind of related to what you just said. Why do you think it is vital that we tackle those challenges, and how we do that? Like, what is the approach you think will work best?
Yeah, let me illustrate the global versus local one with three concrete examples. When we speak pandemic preparedness and response, and this has been a topic in declarations for decades almost, yeah, and we've spoke about this before COVID came, then COVID came, and now it's even more prevalent. But pandemic preparedness is not guaranteed through global institutions based in New York or Geneva or Berlin, for that matter. As we all know, pandemics start and end at community level, and that's local. So what is needed from my perspective here are local surveillance systems and local leadership who wants to understand the root cause of epidemics and pandemics. Another concrete example for this one, we do know, but we hardly do anything against it. We know that on a weekly basis, more than 3,000 adolescent girls and young women in sub-Saharan Africa get newly infected with HIV. And what do we do against that? How do we leverage that local insight? Second example, antimicrobial resistance. We know that contaminated production wastewater is an important reason for the development of antibiotic resistance. So what can we do about it? There's local insights that there are massive breaches of threshold values at 40% of the production sites of antibiotic medicines, even often between several thousand and more than 1,000,000% higher than the threshold. Yet those products might be very affordable for multilateral procurement organizations. So those products might even win the global health tenders. So what is needed from my perspective here is more a global response. We need to improve pharmaceutical discount or tender agreements and have binding environmental criteria pegged and not to those situations and not just price. And a third topic, take the big four, the big three, HIV, tuberculosis, malaria. Issue number one, we invest a lot into malaria, into new malaria medicines, yet the death toll is not decreasing. It's stagnating for a decade or even longer, and has even been accelerated through COVID. So what we need to do is we need to narrow down our perspective into the local perspective and strengthen community care in some difficult to reach areas, upstate Nigeria and the Democratic Republic of Congo, and do partnerships to help community health workers and pregnant women, adolescent girls and young women who present with small babies, because they are the ones who die prematurely, most of them. A second issue, and that is fungal diseases. 1.6 million deaths annually occur from fungal diseases, yet they are grossly undiagnosed. Histoplasmosis, for example, is often misdiagnosed as another entity, namely tuberculosis. And that is because of training, of testing availability, and so on. But if you treat for tuberculosis in case of histoplasmosis, that's not going to help. Yes, so again here, what needs to be strengthened on a local basis, not globally, on a local basis, is implementation science for global health equity.
Thank you for those examples and to kind of the concrete take on like a community level and partnership led approach on which is, you know, as you make your point, is the way to have effective measure applied. So as you moving the conversation a bit more on the international and global space as a G20 and the G7 partnership, what do you think, you know, even thinking like how to promote and apply examples of community-led projects, how do you think the G20 and the G7 as fora and how do they fit into the scenario that you described? How important is to have these two forums work together and have also shared agendas between them?
Yeah, I think the G20 and G7 Health and Development Partnership has a vital role to play. It has played that role and it can continue to play that role, particularly with regard to three topics. Aligning the incentives or contributing to aligning the incentives of actors, because ultimately those incentives are very similar, yet we use different languages. Not in terms of national languages, but we mean different things if we use the same words. And we need to have clarity on what the real goals are and align the incentives behind that. And the partnership with all the different constituents can actually help spot those topics where further alignment is needed. Then it's about helping to differentiate where would a global leadership role be more adequate than a local, and vice versa, similar to the examples I've mentioned. When linking back to the example with antimicrobial resistance, there's a key role to play for the G7, for example, because those countries, those governments are the ones who predominantly fund the multilateral procurement agencies and like the Global Fund or UNICEF or other organizations who procure medicines. But not just medicines. The link between the environment and global health, this is maybe even a separate deep dive topic. I will not touch on this now too critically, but here the broader alignment on a G20 level and not just the G7 is critically important, and to broaden that understanding and joint commitment. What the partnership has already done excellently since 2017 is to convene and to advocate for certain topics. What we can do even more in the future, I think, is to agree, according to the incentives that we jointly negotiate, agree on accountability measures. So having indicators that clearly tell us and also the organizations that we represent through that partnership, where are we missing on our own commitments, and what need we play back to heads of states and governments, where they need to accelerate their perspective or increase their focus on certain topics.
I think that's a clear call to action for the partnership as well, and I think, you know, we look forward to kind of continuing in this interview series with you and with the other global ambassador on coming together for precise recommendation where we can present to, you know, the G20 and the G7, but also create this clear continuum of conversation with then the concrete application of those measures and the accountability for the government. So I thank you again for joining me and in these interviews today, and I look forward to continue the conversation with you.
Thank you very much indeed. Have a good day.
Thank you.